evening, everyone, and welcome to today's webcast, Setting the Landscape and Overview of Health Insurance. My name is Corinne Pettit, and I will be your moderator for tonight's presentation. Before we get started, I would like to go over a few items so that you know how to participate in today's event. We've taken a screenshot of the attendee interface. You should see something that looks like this on your own computer desktop in the upper right corner. You have joined the presentation listening using your computer's speaker system by default. This means that if you can hear music through your computer, you should be able to hear the presentation. If you would prefer to join over the telephone, just select Use Telephone in the audio pane and the dial-in information will be displayed. You will have the opportunity to submit text questions to today's presenters by typing into the questions pane of the control panel. You may send in your questions at any time during the presentation, and we will collect these and address as many as possible at the end. Before I introduce today's speaker, I'd like to take a moment to tell those of you who may be new to the Foundation about who we are, our mission, and what we do. The National Psoriasis Foundation is the world's largest nonprofit patient advocacy organization dedicated to psoriasis and psoriatic arthritis, and we serve as the voice for millions of Americans who are affected by these diseases. Our mission is to drive efforts to cure psoriatic disease and improve the lives of those affected. In order to move our mission forward, we engage thousands of volunteers around the country in activities that will lead to a cure. For more information about these opportunities, you can log into our website after today's program at psoriasis.org. One of the ways we move our mission forward is through our Patient Navigation Center. Our team of patient navigators can help you find specialists, access new medicines, and connect you to others in your community who are living with psoriatic disease. I'm excited to announce that our Navigation Center is offering free health insurance quick guides throughout open enrollment to teach individuals the basics about health insurance and how you can pick the best plan to save money on prescriptions and other healthcare services. To take advantage of this opportunity, please visit the link at the bottom of this slide after our presentation, or you can call 1-800-723-9166. Finally, I would like to thank our sponsors, AbbVie, Celgene, Janssen, Lilly, and Pfizer for making tonight's presentation possible. Today's webcast is the first in a three-part series of webcasts that is focused on health insurance and the barriers to accessing health care. Our next webcast in the series will broadcast on November 8th and focus more in detail on common insurance barriers. You can sign up for future webinars and watch previous ones for free at our website at psoriasis.org/webcast. Now I'd like to introduce our speakers. Today we have a dynamic team from National Psoriasis Foundation to present on this topic. First, we have Mercy Rivera. Mercy works in our Navigation Center and is our bilingual patient navigator. As a native Spanish speaker, Mercy helps people living with psoriatic disease in both English and Spanish. She assists in finding specialists who also speak Spanish and shares educational resources about psoriatic disease and its treatment options. Before joining the Patient Navigation Center team, Mercy worked in the health insurance world where she helped people understand eligibility, benefit coverage, prior authorization, and appeals. Our second speaker today is Jessica Negro. Jessica serves as the Federal Government Relations and Health Policy Manager for National Psoriasis Foundation. In this capacity, Jessica advocates for federal policy reform that advances the NPF mission of finding a cure for psoriatic diseases and dramatically improving health outcomes for all with psoriasis and psoriatic arthritis. Previously, Jessica served as the Policy and Communications Manager at the Elder Care Force Alliance as Director of Public Affairs at a dialysis patient advocacy organization, and as the Press Secretary for Congresswoman Suzanne Cosmas. She also worked on congressional campaigns and at a DC-based think tank. Jessica completed her undergraduate studies in economical and political science at the George Washington University and the London School of Economics. She received an MPA in Health Policy and Management from the Wagner Graduate School of Public Service at New York University. Our final speaker is Ashley Lindberg. Ashley also works as a patient navigator at NPF's Navigation Center. Ashley helps people with psoriasis and psoriatic arthritis understand their insurance coverage and afford specialty drugs. Before joining National Psoriasis Foundation, Ashley worked as a social worker at a skilled nursing facility. In this role, she helped residents navigate the healthcare system, find community resources, and learn the ins and outs of working with Medicare and Medicaid. Welcome, Ashley, Jessica, and Mercy.
Thank you. So I'm going to be going over the main topics for today. we'll be talking about health insurance basics, the different types of insurance, and what to do if you are uninsured. Please feel free to write in your questions during the webinar, and we will try to get to them during the Q&A portion at the end. You can also contact our Patient Navigation Center to get help with your specific insurance situation. Let's start with the health insurance basics. When you have health insurance, you pay for your plan, and in return, your plan helps you pay the cost for your health care. Some of the benefits of having health insurance are access to preventive health services to help you stay healthy. Usually the services are free and include regular checkups and vaccines. Having health insurance also helps you lower the cost for health care and limits your total cost each year. Keep in mind that if you don't have health insurance, you may have to pay a penalty. So what are some of the different types of costs associated with health insurance? There are a few key terms to know when it comes to the different types of costs. But keep in mind that these costs are often less than what you would pay if you needed medical care and did not have health insurance. First, we have the premium. The premium is the amount you pay in order to keep your insurance. You may pay this quarterly or yearly, depending on your plan. If you do not pay your premium, you could lose your health insurance coverage. Your premium does not count towards other costs associated with your health plan. And a higher premium does not mean less coverage. In many instances, it may save you money over the course of the year because the plan offers better coverage. Your out-of-pocket cost is the money that you pay for a healthcare service and can include the deductible, a copay, and coinsurance. It does not include your premium. The deductible is the amount you must pay before your insurance will start to pay for covered healthcare services. For example, if you have a deductible of $1,000, your plan will not pay anything until you have paid the $1,000 for covered healthcare services. Generally, low premium plans tend to come with a very high deductible, so you should take this into consideration when choosing a plan. We will get into the other out-of-pocket costs in the next few slides. So now we have the copay. The copay is the set amount for a healthcare service. So a good example is paying $10 every time you see a healthcare provider or for other types of healthcare. Generally, you will pay a copay or coinsurance each time you receive a medical service. So that would include perhaps your phototherapy treatment appointments, lab work, or any prescription medicines. Some plans have coinsurance, which means that rather than paying a set amount, you pay a percentage of the healthcare cost and your insurance will pay the rest. Generally, you would either pay a copay or a coinsurance for your healthcare. And here's an example of how coinsurance works. So your insurance company pays 80% of your health insurance bill, and you pay 20%. If your office visit costs $120 and you have already met your deductible, your coinsurance payment of 20% will be $24. Your health fund will have out-of-pocket maximums or a limit for the year. Once you reach that limit, you will not pay any more out-of-pocket costs for the remainder of that year. Remember that your out-of-pocket cost is the money that you pay for a healthcare service and can include your deductible, your copay, and your coinsurance. It does not include your premiums. We will go into more detail about the different types of health insurance in the upcoming slides. We will be discussing how out-of-pocket maximums are different for the types of insurance, such as Medicare and commercial insurance. These are the different types of health plans. An HMO requires you to get a referral before seeing a specialist and only pays for in-network providers. An EPO lets you see a specialist without a referral, but still only pays for in-network providers. And an EPO lets you see a specialist without a referral and will pay some of the costs associated with seeing an out-of-network provider. So these are some of the things to consider when choosing a health plan. You want to consider what type of health services and providers you need, whether that is a primary care doctor, a specialist such as the dermatologist or rheumatologist, if you like to have coverage for alternative treatment, or any additional benefits such as vision and or dental. Also, you want to ask yourself what type of coverage you need for prescription medicine. You may want to look at drug formularies to make sure your treatments are covered by the plans you're considering and at what cost. You also want to ask yourself if you prefer to see any provider of your choice. You want to consider the in-network provider size of the different plans that you're looking at. Also, you want to determine whether or not you're willing to work with a primary care provider to get referrals to a specialist. It is important to understand your coverage. If you already have insurance, you can view your benefit summary, which you can generally find through the health insurance website. If you're shopping for insurance, be sure to check what is covered and the different costs associated with each plan. Keep in mind that you can call the administrator of the health plan you're considering to better understand the coverage and cost. If you have questions after reviewing your medical plan summary, we're here to help you better understand your coverage. So feel free to give our Patient Navigation Center a call, and we'll go over those plan specifics. You may also call your health insurance administrator to talk over the details of your plan. Now, we're going to go over the different types of insurance, starting with commercial insurance. So let's talk about the different ways that you can get health insurance. From our first slide, we know that there are three main ways that you can get health insurance. That would be commercial coverage, Medicare, and Medicaid. We'll talk first about commercial insurance, which can include plans that are employer-based, privately purchased, or purchased directly through the marketplace. We will mostly be focusing on commercial insurance through the marketplace today. When comparing plans, you will want to consider the different costs associated with each type of plan. It's good to remember that your premium is the amount you pay to keep your insurance, and your out-of-pocket cost is the money you pay for a healthcare service. This would include your deductible, co-pays, and co-insurance. This table shows you the different levels of plans in the marketplace. As you can notice, if you don't use many healthcare services throughout the year, your out-of-pocket cost may not be that high if you purchase a bronze plan because you're not paying co-pays or co-insurance on those services. And while the other plan levels may have higher premiums, they may help you reduce your total cost, your total out-of-pocket cost for the year. Again, the out-of-pocket maximum does not include your monthly premiums, and it does not include anything that you spend on healthcare services that are not covered by your plan. Now we're looking at a screenshot of the health insurance marketplace where you can shop for commercial plans. Note that some states have their own marketplace with their specific name and specific website. If you're not sure if your state has its own marketplace, you can go to the healthcare.gov website and start the enrollment process that will direct you to your state's marketplace if it is separate. Something to actually consider is starting to look at the marketplace plans that are available for 2018. The information about these plans is already available for you to view and compare. It is important that you take the time now to verify your account information if you have previously purchased a plan on the marketplace, or set up your marketplace account now so that you can shop and compare the plans that are available. When you verify your information or set up your marketplace account, you'll be asked to submit information about your 2017 taxes and income. We will go into more details about shopping for plans in the second webcast of this series, which is scheduled for November 8th. But know that you can shop the plans and compare the costs and benefits without having to enroll or purchase a plan at the same time. There are many different resources to help you compare and choose a health plan. Here are a couple of free calculators that help you compare costs of health plans on the marketplace. You simply would enter your state, your income, and number of people in your household, and they will show you your plan options, your costs, and whether or not you qualify for subsidies or cost savings on your plan. Now I'll be passing it on to Jessica Negro in our advocacy team to go over the next topic.
Great, thank you very much, Mercy. So now we'll discuss a few additional patient protections that have been put in place by states across the country. You don't? Okay, perfect. So while some healthcare rules are set by the federal government, many are actually established by individual states. Over the last few years, several states have passed laws or established new rules that help consumers afford healthcare. Here are a few examples you can see on the slide, and we'll go through each of these in turn. So first, we'll start with per prescription out-of-pocket limits. Recently, the states of California, Delaware, Louisiana, Maryland, and DC have established limits on what patients have to pay out-of-pocket per medication. These rules cap the copay or coinsurance that was discussed previously that individuals can be charged per medication once the deductible has been met. These are all post-deductible. The second is annual out-of-pocket limits. These are related to what we just discussed, but the states of Maine and Vermont have capped the total out-of-pocket spending per prescription medication. In these states, patients can reach an annual limit on what they are asked to pay out-of-pocket, at which point the insurer pays the totality of the cost. The first slide was per medication, and in these two states, they've capped the totality of out-of-pocket costs for patients per year. Thirdly, the state of New York recently passed a law to prohibit specialty tiers in drug formularies. As we mentioned, drug formularies are the list of covered drugs for each insurance plan. Drug formularies usually contain multiple tiers that dictate how expensive certain medications are for patients. The first tier, which is usually for generic medications, has the lowest copay rate. Specialty tiers are historically the most expensive and often charge a coinsurance or a percentage of the drug cost. In New York now, specialty tiers will no longer be permitted, which means that you can't charge more for these medications, and they're often biologics for our community, than you could for non-preferred brand drugs. So this helps to rein in the costs for individuals who are taking expensive medications. Next, the states of Colorado and Montana passed laws to change the type of insurance products that are available to consumers. In these two states, a full quarter of insurance plans offered in each of the offered in the marketplaces must be copay only. Therefore, they can't charge coinsurance rates for medications. These can be helpful for consumers to better understand and plan ahead for their costs, because it can be easier to understand what your copay out-of-pocket will be versus paying a coinsurance or a percentage of a drug cost when it might always not be clear what the drug would cost to you. So now in these two states, a quarter of all plans are copay only on the marketplaces. And lastly, the states listed on this slide have passed laws that require insurance companies to notify enrollees if they change their drug formulary or that list of covered drugs. These changes can be at the start of a new plan year or can sometimes happen actually mid-year. Being notified of this helps consumers understand what's covered and what's not, and is a good reason to look at their formularies and assess what's covered for the next year when you're going to shop around and plan for next year's insurance plan. So these are the sampling of some of the consumer protections that have been put in place across the country. And now I will turn it over to Ashley from the Patient Navigation Center. Thank you.
Thank you, Jessica. So now we are going to go over Medicare. So Medicare is a health insurance program that's administered by the federal government. You are eligible for Medicare if you're either 65 years or older, or if you're under 65 and you're receiving Social Security disability or are living with certain health conditions, you may also qualify. All right, so we're going to start off by going over the different types of Medicare plans. So there are different plans or parts to Medicare that generally have a letter name. So when thinking about Medicare, we're often referring to Part A and Part B. And together, Part A and Part B are generally referred to as traditional Medicare or original Medicare. So as you can see from these lists here, the different parts cover different benefits. So starting with Part A, it's also known as hospital insurance. You may hear it be referred to as hospital insurance. So this covers necessary hospital care, care in a skilled nursing facility, some home health care, and then hospice care as well. And then with Part B, it's also known as medical insurance. So this covers more outpatient services. So appointments with your healthcare provider, preventative care, durable medical equipment, and hospital outpatient services, which can also include prescription drug infusions and injections if you're receiving these at your doctor's office or at like an outpatient infusion center as well. So now we are going to go over Medicare Advantage plans. So when you have Medicare, you have several different options for your health insurance coverage. You can either go with traditional Medicare, which we went over in the previous slide, or you can choose to have a Medicare Advantage plan, and this is also known as Medicare Part C. So you cannot have both, as Medicare Advantage plans provide the same coverage included in traditional Medicare. However, with Medicare Advantage plans, you may also get some extra benefits such as vision, dental, and in some cases, prescription drug coverage as well. So if you have a traditional Medicare plan, so that would be Parts A and B, or if you have a Medicare Advantage plan that does not offer prescription drug coverage, you may also consider enrolling in a Part D plan, which would provide prescription drug coverage. So you would use your Part D prescription drug coverage for drugs that you receive from a pharmacy. So this is whether you get them from your local food or drug store or a mail order pharmacy or specialty pharmacy. Another part to Medicare that you might consider if you have a traditional Medicare plan is a Medigap plan. And this may also be referred to as a supplement plan. This type of plan is offered by private insurance companies. And Medigap plans help to pay for costs that traditional Medicare does not cover, such as copays, coinsurance, and deductibles. This type of plan acts as kind of like a secondary insurance plan. All right, so a big question to consider is whether to go with a traditional Medicare plan or a Medicare Advantage plan. So here we've put together a side-by-side comparison of both plan types. So if you're looking at potential costs, know that there is no limit on how much you pay out of pocket per year with traditional Medicare, unless you have a Medigap plan. With Medicare Advantage, plans do have a yearly limit on your out-of-pocket costs. In terms of coverage, Medicare Advantage plans will cover everything that traditional Medicare covers. However, like I mentioned earlier, Medicare Advantage plans may also have some additional benefits like vision, hearing, and dental. And in terms of supplemental coverage, you're only able to get a Medigap plan if you have a traditional Medicare plan. You cannot have a Medigap policy if you also have a Medicare Advantage plan. So here we have some other differences between traditional Medicare and Medicare Advantage plans. So with traditional Medicare, you'll need to purchase a Part D plan to get prescription drug coverage, whereas with many Medicare Advantage plans, prescription drug coverage is included. There can be some noticeable differences between these two plan types in terms of your provider and hospital choice. So with traditional Medicare, you can go to any healthcare provider that accepts Medicare. However, with a Medicare Advantage plan, in-network providers may be more limited. So for instance, a provider that you would like to go to may accept Medicare, but they may not accept your specific Medicare Advantage plan. Okay, so here is just an overview of each type of Medicare plan that we've gone over so far. And I know there's a lot of content in this presentation, so feel free to reach out to the Patient Navigation Center if you want a copy of this information after the webcast. All right, so we have discussed some of the things that are important to consider when choosing a health plan earlier in this presentation, but there are some things specific to Medicare that need to be considered as well. So when looking at costs with Medicare, you want to look at the overall picture. So these costs can include your monthly premiums, your out-of-pocket costs, and annual out-of-pocket maximums. So it may seem more affordable to go with a plan with the lowest cost premium, but consider if whether the plan you choose will actually provide you with the coverage that you're going to need for the following year. So are you going to need vision and dental coverage? Do your current providers accept the Medicare plan or plans that you are considering? And if you need prescription drug coverage, are your current medications on the formulary of the plan that you are considering? And so here's just a screenshot of Medicare.gov, which has a bunch of helpful resources if you want to find out more about Medicare and Medicare coverage. It also has a helpful plan finder tool, which can help when comparing your options. So this Medicare plan finder tool allows you to enter in your location and your specific prescription drugs. It will then bring up a list of all Part D and Medicare Advantage plans in your area, and it'll actually also show traditional Medicare plan with cost estimates. So you can then compare all these plans by cost and coverage, and it's really handy. It can even give you an estimate of your expected prescription drug copays with each plan. And if you want any help finding or using this tool, just feel free to reach out to us. All right, so Medicare open enrollment has already started. It runs from October 15th through December 7th. And at this time, you can make changes to your Medicare Part D coverage. You can switch from a traditional Medicare plan to a Medicare Advantage plan, and you can go from one Medicare Advantage plan to another at this time. So now we are going to talk about Medicaid. So similar to Medicare, Medicaid is a government-based health insurance. However, it's administered at the state level. So it is important to understand that Medicaid works like any other type of health insurance in that you have the ability to see any healthcare provider, including specialists, that accept Medicaid. Medicaid will generally pay for all healthcare costs, including your prescription medicines. Being on Medicaid certainly does not mean that you are unable to access treatments such as biologics or phototherapy, which is a common misconception. So we will go into more detail about accessing treatments and services while on Medicaid in our next webinar, which focuses on common insurance barriers. So each state may offer different types of Medicaid programs that are generally based on income and possibly other specific factors like the ones listed here on this slide. Because Medicaid is different for each state, the eligibility requirements are also different for each state and the specific programs. So if you qualify for Medicaid, generally you will be able to receive health insurance at minimal to no cost. So as I mentioned on the previous slide, states offer different programs that have different eligibility requirements. An important factor to consider when thinking about eligibility for Medicaid is whether or not your state has expanded its Medicaid programs. So for states that have expanded their Medicaid program, the eligibility requirements may now be easier to meet because eligibility is based only on income. So if your household income puts you below 138% of the federal poverty level, you would qualify for Medicaid in one of these states. So I'll give you some examples of what 138% of the federal poverty level would look like for various household sizes. And this information is for contiguous states and DC, so not for those living in Alaska and Hawaii, and those amounts can be slightly higher. So for an individual household of one, 138% of the federal poverty level would be $16,643 a year. So if you're making that or under, you may qualify for Medicaid in your state. And for example, a household of four, if you are making $33,948 a year, that would put you at 138% or below the federal poverty level, and that could mean that you qualify for Medicaid as well. For the states that have not expanded Medicaid, they may have more eligibility requirements that vary by program. For instance, in addition to an income requirement, individuals may not be eligible for Medicaid unless they also have a disability, or for instance, if they are pregnant or have children. So this slide shows the 32 states that have expanded Medicaid. And knowing whether or not your state has expanded Medicaid is important to understand because you may qualify for reduced cost health coverage. If you would like more information on your state's Medicaid program, you can contact your local Department of Health and Human Services agency, or you can also contact the Patient Navigation Center, and we'd be happy to help you look into the Medicaid benefits in your state as well. If your income is below 100% of the federal poverty level and your state has not expanded Medicaid, you may be in a coverage gap. And this is because you won't qualify for Medicaid based on income alone, and you will not qualify for subsidies or tax credits if you're shopping for a health plan on the marketplace. So for those who are in this coverage gap, please know that there still may be options for accessing health care without health insurance. And that is what we're going to talk about next. So what to do if you're uninsured. If you're uninsured, there are two main ways for you to get health care. Number one, you can see if you're eligible for health insurance. And number two, you can access health care as an uninsured person, meaning finding free or low-cost care that you can pay out of pocket for. If you do not have health insurance, explore all of your coverage options first to see if you are eligible for Medicare, Medicaid, or if you can afford a commercial health insurance plan through the marketplace. You can see on this slide there are some resources listed to check out different insurance options. You're still required to have insurance under the Affordable Care Act, and if you don't have health insurance, you may have to pay a penalty, so just keep that in mind. So if you're not eligible for Medicare, Medicaid, and the options on the marketplace are not affordable, there are some other ways to access health care. So the first way would be to find an affordable health care provider. And you may be able to find a provider within a low-cost or sliding scale clinic. And a sliding scale clinic would charge you an amount based on your income. You may also be able to find a provider that offers a cash paying discount. And some university medical centers and hospitals also offer financial assistance programs to eligible individuals. When you are searching through these different provider options, it's important to understand the differences in services that may be offered with each option. So for instance, care at a low-cost or sliding scale clinic, health clinic may be more affordable, but in many cases you may be getting most of your care from a primary care provider. On the other hand, appointments at a dermatology or rheumatology office may cost more even with a cash paying discount. However, this option would allow you to receive specialty care. And if you are in the process of looking for a health care provider that you can access affordably, just please reach out to us at the Patient Navigation Center, where we can help you locate these provider options. We can send you a list of questions that can be helpful when calling to make appointments, and we can also help you prepare for your first appointment. All right, so regardless of your insurance status, all treatment options should be available to you. So this chart here identifies some ways to make treatments more affordable, from topicals to biologics. As you can see, there are clinical trials for many treatments. There are patient assistance programs, coupons, and ways to compare medication costs. If you are treating your psoriasis with phototherapy, you should keep in mind that phototherapy requires regular treatments that can be costly, even with the possibility of cash paying discounts mentioned on this slide. If you have health insurance, there are also different resources and financial assistance options to help you better afford your treatment. And we will be spending more time diving into specific programs and assistance in our next webinar, which is scheduled for November 8th. So today we just wanted to highlight some of the options for accessing affordable treatments if you are without health insurance. So here's a list of resources that may be helpful in better understanding and accessing your health care. And if you don't have time to write these down, just reach out to the Patient Navigation Center, and we would be happy to provide you with a copy of these resources. If you have any questions specifically regarding patient protections, please contact our advocacy coordinator, Katie Olson, at kolson@psoriasis.org. Great, thank you so much for sharing your insights with us. And so we are going to now move into the Q&A portion of our webcast. And so you can submit your questions through the question pane on the control panel, and we will get to as many as we can. All right, so the first question is for Ashley. How can you determine what the copay, et cetera, for biologics will be for Medicare plans? And so there are a few different ways you can do this. If you're sticking with your current Medicare plan and you just want to know what you can expect for the copay cost, you can contact the plan and ask those questions. But if you're shopping for a new Medicare plan, you can use the Medicare Plan Finder tool on Medicare.gov. So that's what I mentioned earlier in the webcast. So with this tool, you can enter the name of specific biologics. You can even enter names of just biologics that you're interested in, and maybe you just want to know what you can expect to pay. And then you'll be able to compare plans by things like your biologic copays for each treatment. Great, thank you. We have another question here, and this is for Jessica. Can insurance companies once again start denying coverage to people with like psoriasis?
That's a really great question. I know there's been a lot of confusion about all the talk in DC about changes to the Affordable Care Act, but it's really important for people to know that nothing has changed, that going forward, as of now, insurance companies are certainly still required to offer insurance to those with pre-existing conditions like psoriasis. They cannot charge more for individuals with chronic conditions. The essential health benefits are still in place, so all plans are required to cover a series of benefits, including chronic condition coverage. And so all of those patient protections that were put in place by the ACA are still in place now and will be for the 2018 market year.
Perfect, thanks so much. Next question here is for Mercy. What steps can I take to help my providers get my medication approved?
Well, that's a really good question. I think it's important to be familiar with your insurance drug formulary, since certain medications may require approval by your insurance. This will include a medical review process. So it's important that your doctor is aware of any medications that you have tried in the past and reasons as to why they didn't work, because this is essentially what the health insurance wants to look at to determine if the drug is going to be approved for you. I would also suggest just getting more familiar with the drug formulary and knowing what medications are generally covered for psoriasis.
Okay, thanks so much. We have another question here for Ashley. Psoriasis drugs are so expensive. How can I get them cheaper?
So there are many ways to get the cost of your psoriasis treatments lowered. So there are things like copay assistance programs or patient assistance programs, coupons, and programs through your state. So these options are available, but they can depend on many things. So like, if you have health insurance, and if so, what type of plan you have. Also, other factors can be your income and where you live. So that can make a difference in what programs you're eligible for. You can contact the Patient Navigation Center, and we'd be happy to help you look into all of your options.
Great, thanks so much. Somewhat similar question here for Mercy. What options are available when insurance proves biologic prescription, but the cost is prohibitive, specifically $1,500 per month?
Okay. Well, as Ashley just mentioned, there are different resources that can help with the total cost of your out-of-pocket for specific treatments. So typically, the first route is to check drug manufacturer programs that can assist you with the cost. There's also discount programs as well as coupons that you can find online, and we do have those resources to help you. So feel free to give us a call, and we can go over things that you may qualify for.
Perfect. Question coming in for Ashley. Is there an insurance to cover the cost of drugs when you're in the donut hole?
So unfortunately, there's not an insurance plan that will cover cost of drugs in the donut hole. For those of you who are not familiar with the Medicare donut hole, it's also known as the coverage gap. It's a stage of coverage that some people may enter after spending a certain amount on their covered prescription drugs for a given year. So when in the coverage gap, individuals are responsible for a greater share of their prescription drug costs. So for 2017, you'll be responsible for 40% of the cost of brand name prescription drugs while in the coverage gap. The good news is this percentage is scheduled to get smaller each year. For instance, next year you'll pay 35% for brand name drugs in the coverage gap. And I believe by 2020, you'll pay no more than 25% for brand name drugs in the coverage gap.
Great, thank you. Next question here for Jessica. How do I know if my insurance requires step-up therapy? With over 35 years of psoriasis, I know what works and doesn't for me.
That's a really great question. For those who might not be aware, there's an insurance protocol called step therapy. It's sometimes called fail first policies. And what it means is that if your dermatologist prescribes a medication for you, your insurance company might actually turn around and say, before we'll cover that medication your doctor wants you to, we're going to require that you try these other medications first and fail on them effectively before we'll cover the drug that your physician originally prescribed. It's something that our advocacy team is working very hard to reform, both at the state and federal level. But in the meantime, if you want to know in advance if your formulary might require these step-up policies, it'll actually be listed on the formulary itself. So if you go in and look at the list of covered medications, it will be clear if it requires a step or if it requires prior authorization. And so you can take a look there, or you can always call your insurance company, and they will give you that information in advance.
Thanks so much. Next question here from Mercy. If you are on a medication that's being subsidized by your PPO and then you go on Medicare, how does that affect your coverage?
That is a very good question. Unfortunately, it's not a question that I can truly answer because there are many factors that come into play. A main one would be the type of Medicare coverage that you'll have. And as we have gone over, or as Ashley went over, there are different types and potential coverage types for Medicare. So without that information, there truly isn't a way to answer the question, but know that we do have the ability to help you look through the plans that are available for you when you're ready to go on to Medicare.
Thanks so much. Another Medicare question here we have for Ashley. I'm on Stelara for serious psoriasis. What are my options when I am put on Medicare due to SSDI in May of 2018?
Yeah, so there are certainly Medicare plans that provide coverage for Stelara. It's just a matter of looking up options for your specific area. So aside from the Medicare Plan Finder, which I mentioned earlier, a great resource for in-person help when choosing a Medicare plan is your local SHIP center, and SHIP stands for State Health Insurance Assistance Programs. So it can go by a different name depending on where you live, but SHIP centers provide free assistance to people with Medicare, and it can be especially helpful when looking into your coverage options. So if you'd like if you would like help finding the SHIP center closest to you, feel free to reach out to us and we can help you locate that. If you happen to be on a Medicare plan that does not provide coverage for Stelara, there's also a program called the Johnson & Johnson Patient Assistance Foundation that you may qualify for. So we can help you find out more information about that program and if you would qualify for that. And also, I think it's important to know that Stelara can be billed two different ways. So it can go through your prescription drug coverage if you get it directly from a pharmacy, and it can go through your medical coverage or your Part B coverage if you get it injected at a doctor's office or outpatient clinic. So you can get in touch with us, or you can even get in touch with the Stelara Patient Support Hub, and we can help you look into which option would be more affordable for you.
We have a follow-up question on SEP therapy for Jessica. My insurance company told me I need to take methotrexate before approving a biologic. I've taken methotrexate, but it was over 10 years ago with a different insurance company and it didn't work for me. I have been unable to prove this, however. Do I have to suck it up and take methotrexate again?
That's a really wonderful question, and I definitely encourage for the person who asked it to contact our navigation center, and they can help you on an individual basis. Depending on the state you live in and how much sort of ability your physician has to help you out, I'd hope that we could work through many insurance companies offer exception processes, and so hopefully we could make that happen for you. But I would definitely encourage you to contact your navigation center, and we can see if we can provide you some assistance because we'd appreciate you. We'd love for you not to have to go through that all over again.
Perfect. It looks like we have one final question here from Mercy. Could you please explain what to do when an off-label drug is denied, but all current approved drugs have failed?
Sure. You can have your provider submit a prior authorization to your insurance indicating why it's medically necessary for you to be on this off-label drug. It's very important during this process that your provider does include any other drugs that you might have tried in the past and have failed.
Well, thank you so much. And if you have any other questions, please contact our Patient Navigation Center by phone, email, live chat, or Skype. Once you leave today's webinar, you will receive a survey on the presentation, and we would appreciate it if you would complete that and provide your feedback. As a reminder, our Patient Navigation Center is offering free health insurance quick guides, and you can get yours by following the link after leaving the webinar. Thank you again to our sponsors, AbbVie, Celgene, Janssen, Lilly, and Pfizer. And finally, I just want to mention that a recording of tonight's webcast will be available shortly on our website, and you can access our complete webcast archive by visiting psoriasis.org/webcast. Thank you, everyone, for joining us tonight, and I hope you have a lovely evening.